Where are your clinics, and do all of them treat women over 40, and up to what age with their own eggs? Your website also mentions special considerations that you make for women over 40. Could you expand on that a bit?
Sure. So we currently have sort of 3.5 clinics. So we have one in Windsor, Ontario, Sarnia, Ontario, St. Catharines, Ontario, and we are in the process of opening up a third clinic in Woodstock, Ontario. So they're all Ontario based. I will actually be starting in the UK shortly. I've got my license there now. I'm just waiting for my work permit. So hopefully in the new year, I'll be coming to the UK as well, because I think the UK deserves greater transparency and less private equity, venture capital driven fertility care than they're getting now. So in terms of how old I will allow someone to use their own eggs, we don't actually have a limit other than that we tell people over the age of 55 that in our particular practice, from an ethical standpoint, we think that it gets ethically complicated becoming a parent over the age of 55, mainly because it based on national or international age sort of lifespans, we know that the child will be very young when there's a substantial chance it will no longer have parents. And so we don't love the idea of doing it over the age of 55. However, we do consider every case on a case-by-case basis. Up until 55, I'm willing to try, but these are lengthy and detailed conversations that we have with the patients, giving them a very realistic appraisal of what their chances are. So we will sit down and discuss with them, here is your AMH, here is your antral follicle count, here is your previous history, here's your partner's sperm, this is what you can expect as an outcome. And not just in terms of a percentage, because I think that's important for us to elucidate for patients and say your chance per cycle is X percentage, but we also will tell them how many cycles that's actually going to translate to. So we even have a video on our YouTube channel called Embryo Math, where it literally teaches people to essentially calculate, this is what you should anticipate for the number of cycles you're going to need based on your age, your AMH, your BMI, your partner's sperm, and so on. So we make sure that we are detailing everything necessary for patients to have total transparency about what the expectations are from their journey. It's easy to go into a fertility clinic and be told, yep, no problem, you need IVF, and we're going to help you, and we're going to make eggs, and we're going to test them or not test them, and we're going to do transfers. And people are wholly invested because what they're hearing is, I have a chance. And what they're not understanding is it's going to take you 5 rounds of IVF to get to that actual chance. So we're very open about that. We're the clinic that tells them you're going to need 5 chances, like 5 rounds of IVF or maybe more. And certainly if you're seeing women who are in their 50s and they want to try, it is virtually impossible. And we will advise them of that. They need to know. Now, is it possible? Yes. Are there women that succeed? Yes. But they need to know this is a 1% chance or a 2% chance. And as long as you're transparent about that, we're open to helping them.